Hello and welcome to our Nur2106 assignment. Our names are Alice, Pia, Ash and Sophie. Diabetes mellitus is a progressive condition of the endocrine system in which the body becomes resistant to insulin. Around 1.2 million people in Australia have diabetes, and type 2 diabetes represents about 85 to 90% of these cases. It is most commonly found in older adults, but is increasingly occurring in younger Australians, largely due to social factors. For many, the first signs are complications of type 2 diabetes, such as foot ulcers, heart attack, and slow-healing wounds. This video will discuss a patient presenting with a slow-healing surgical wound post-C-section secondary to diabetes mellitus type 2. We'll discuss the pathophysiology, the pharmacology and nursing interventions in regards to one patient, Lillian. My name's Pia and I'm here to introduce you to Lillian. She's a 35-year-old Australian woman who is overweight and of a low socio-economic status. She lives with her husband and her 2 children, a 2-year-old son and a 6-week-old daughter. After conducting a thorough health history assessment on Lillian, it is found that she has polycystic ovarian syndrome, otherwise known as PCOS, hypertension or high blood pressure, and has no known allergies. PCOS has been found to be associated with the development of type 2 diabetes, as it is related to insulin resistance and impaired regulation of blood glucose levels. Thus, both hypertension and PCOS can be huge risk factors for the development of type 2 diabetes. Furthermore, by having a family history of type 2 diabetes, especially an immediate relative such as Lillian's mother, can increase Lillian's risk of development of type 2 diabetes from 3.2% to 14.3%. Lillian complains of fatigue, thirst or polydipsia, blurred vision and increased urine output or polyuria. She presents 6 weeks postpartum with an open caesarean wound which is slow healing after having a 4.9 kilogram baby girl. Upon further investigation, it is found she has type 2 diabetes, which is affecting the healing process of her surgical wound. Other typical signs of type 2 diabetes include foot ulcers, increased appetite, headaches, mood swings, leg cramps and dizziness. Lillian's diet consists of processed food, soft drink and foods high in saturated fat and trans fatty acids. She also has a low intake of fruit, vegetables, water, with a very sedentary lifestyle. According to Kathy Breen and her colleagues in their 2015 study into nutrition and diabetes, both poor nutrition and low physical activity are significant risk factors for Lillian developing type 2 diabetes mellitus.
Type 2 diabetes mellitus is a metabolic disorder characterized by the presence of chronic hyperglycemia. It involves 2 pathogenic mechanisms. Firstly, a progressive decline in pancreatic cell function, resulting in a decrease in insulin secretion. Secondly, peripheral insulin resistance, resulting in a decrease in metabolic reactions to insulin. Because these mechanisms cannot regulate insulin, there is an excess glucose in the blood. Blood glucose levels remain high in type 2 diabetes mellitus patients after they eat a meal. This is because the glucose consumed is unable to enter the tissue cells and is then secreted in urine as a waste product. The transition of normal blood glucose levels to type 2 diabetes mellitus occurs in the intermediate stages of altered metabolism with insulin resistance. Over time, the pancreas responds to the insulin resistance, secreting more and more insulin, creating the high blood glucose levels. There are 3 major signs that a patient suffers from type 2 diabetes mellitus, and Lillian's patient profile and history reveals all 3 of these. Firstly, polyuria is an increased urine output. Lillian's patient history reveals her experiencing this. Through having an increased urine output, Lillian's blood volume will decrease, which may cause her to experience dehydration. Secondly, polydyspia is an increased thirst, of which Lillian has also experienced. Her polydyspia is linked to her polyuria and the associated dehydration. Lastly, polyphagia is an excessive hunger and food consumption. Lillian's profile doesn't describe her experiencing this, although because her body is unable to absorb the glucose in food, it stores fats and protein for metabolism instead. This explains her obesity. Lillian also has a genetic disposition to type 2 diabetes mellitus, as it is in her family history. Because Lillian is overweight, she is also at a higher risk of obtaining such condition. There are many medical complications associated with type 2 diabetes mellitus, which Lillian could come into contact with in the future through having her condition. Diabetes increases the risk of many cardiovascular complications from occurring. These include coronary heart disease, angina, myocardial infarction, stroke, atherosclerosis, and hypertension. Diabetes also induces diabetic retinopathy, which is damage to the eye blood vessels. This damage may progress to vision loss and blindness. It also increases the risk of vision conditions such as cataracts and glaucoma. Diabetic nephropathy, or kidney damage, affects 1/3 of diabetes mellitus patients. In this condition, the nephron filtration system is damaged, which causes kidney failure. Diabetes mellitus causes many complications to the nervous system and is the most common cause of neuropathy or peripheral nerve damage. Nerve damage is caused due to high blood glucose levels with people with diabetes. This can cause tingling, numbness, pain, muscle weakness, and/or diabetic skin ulcers in the patient's peripherals. People who have had diabetes for a long time and who have poorly controlled their blood glucose levels are at the highest risk of neuropathic damage.
Pharmacological interventions. 1. Wound management. Lillian has just undertaken a C-section and the wound needs appropriate dressing to ensure accurate healing and determining factors which have caused a slow healing process. There are several factors that affect wound healing. The nurse needs to firstly assess the wound to identify what may be causing slow or altered healing to the patient. This may involve using a skin healing chart. The nurse may also assess Lillian's nutritional status, and dressing selection plays a very important role in wound healing. The right non-adhering product can aid in the healing process and prevent further insult with the dressing changes. This may include products such as a non-adherent dressing, foam dressing, hydrogels, topical bandage, calcium alginates, hydrofiber, acrylic dressing. There is possibility of infection, so therefore a special considerations chart is needed for infected wounds as they require differentiating treatment. Patients such as Lillian who have suspected type 2 diabetes can be given a combination of insulin and other medications to help control their blood glucose levels. This form of intervention is highly recommended with a healthy diet and exercise. This includes educating Lillian about the importance of regular checks of her glucose levels to ensure the dosage of medication is correct. There are 7 different classes of medications to treat type 2 diabetes. However, Lillian is now a mother and will most likely be breastfeeding, and most of these medications would be unsuitable for her as they can be transferred in the breast milk. Sodium glucose transport inhibitors. Classified as a Category C in pregnancy. There is no formal studies that they are transferred in the breast milk, so to consume the medication only if the benefits outweigh the risk. The child should be continually monitored for hypoglycemia. Side effects include urinary tract infections, genital thrush, and increased urination or acidosis. This medication should be monitored or adjusted for those with renal problems, as this medication can sometimes be ineffective with patients for the elderly or over the age of 75. Incretin mimetics. Medication that act like incretin hormones and bind to receptors to stimulate glucose-dependent insulin release, therefore acting as anti-hypoglycemics. They're usually given by injection, and side effects include diarrhea, nausea, vomiting, headaches, dizziness, increased sweating, indigestion, and constipation. Contraindications include cautions during breastfeeding, renal impairment, and other medications such as warfarin. Hypertensive medication. Although individual medications vary for pregnancy and breastfeeding. Most of the antihypertensive medications are suggested to be avoided for mothers as there is evidence in the presence of the breast milk and therefore can be passed on to the newborn. Most of them also influence blood sugar levels, and health clinicians should assess the blood pressure regularly before and after the dose has been given. This includes ACE inhibitors, diuretics, beta blockers, antihypertensives, calcium channel blockers, and vasodilators. Diuretics act by blocking the sodium absorption in the nephron in the kidney. This allows for the reduced fluid in the blood vessels and helps lower your blood pressure. It is classified as a Category C in pregnancy, and there are 3 different types. Side effects include more or less potassium in the blood, low levels of sodium, headache, dizziness, thirst, increased blood sugar, muscle cramps, and skin rash or disease. Contraindications include antidepressants, digoxin, or cyclosporin. Beta blockers. Different types of beta blockers work differently. They enhance the heart's ability to relax so it beats less forcefully and slower when the medication is taken. This can help alleviate irregular heart rhythms. Some beta blockers only work on the heart itself, while the others can focus on the heart and the blood vessels throughout the body. Most medications also protect bones as they prevent the kidneys from excreting calcium into the urine and block stress hormones, making it an added benefit to taking these medications. Side effects include fatigue, cold hands, headache, digestive problems, constipation, and dizziness. They also can trigger asthma attacks with people suffering from asthma. Lillian may not be able to take this medication, as also can affect the blood sugar and not recommended with people with diabetes. 4. Pain medication. Pain is a subjective experience and unique for every patient. For Lillian's case, it may be that she has pain in the subcutaneous tissues or combined with visceral pain that may occur in the thorax, cranium, or abdomen. She currently had a C-section and indicates the pain may be coming from the organs have stretched abnormally and distended or inflamed. Non-opioids analgesia, usually for mild to moderate pain, and include your non-steroid anti-inflammatory drugs. Foods or antacids are recommended with this medication, and there also is some evidence that people who also have a comorbidity of asthma can be sensitive to these drugs. These are things such as paracetamol, aspirin, or ibuprofen. Opioids. Opioids are usually for moderate to severe pain. These are included with sedation, nausea, and constipation. They may require extra fibre in the patient's diet or increase fluids. Respiratory depression is another side effect that is commonly feared by patients. The patient may need to be physically stimulated or reminders to breathe deeply, or if that is ineffective, then Noxolone should be prescribed. These are medications such as morphine, oxycodone, codeine, pethidine, and methadone. Adjuvant drugs can enhance the effects for opioids by providing additional pain relief. They can also reduce some side effects from other drugs and reduce any anxiety that the patient may be feeling due to pain. These are more commonly used for chronic pain rather than acute setting, such as tramadol, anticonvulsants, and antidepressants. For Lillian's pain, she may most likely need a combination of both non-opioids analgesia and opioids. This would cover both ongoing pain and breakthrough pain if she requires any pain relief for her post-operative care.
The next section is nursing interventions, where we chose 5 specific interventions to focus on. The first intervention is patient education. We chose this to improve Lillian's knowledge of her health status and to support and facilitate self-care and independence. It is about shared decision-making and encouraging self-management. We would inform Lillian both verbally and in written form about the following topics: her condition, importance of diet, effects of medication, prevention strategies for hypo and hyperglycemia, healthy lifestyle habits including exercise, recognizing symptoms and complications, long-term complications, and how her condition may affect motherhood. People involved in patient education include the nursing team, the physician, endocrinologist, dietitian, physio, GP, online and over-the-phone resources. Intervention 2 is glucose monitoring, which will assist Lillian in maintaining a stable blood glucose level and prevent deterioration, acute medical events, and long-term complications. We would manage her blood glucose by regularly testing at multiple times throughout the day, testing before and after meals, changing the time of testing each day, and responding accordingly to the test results. One source we read said that we should test around 8 times a day for optimal effect. We would also make sure the procedure was safe and we used hand hygiene. The nursing team would be involved in taking regular BGLs. The physician and endocrinologist would review Lillian's status, and the MET team may be called if an emergency was to take place. The third intervention is insulin therapy and medication administration. This will treat Lillian's insulin resistance in conjunction with lifestyle changes. Other medications may also be given to help control blood sugar levels and clinical manifestation. We will administer any injectable treatments via doctor's orders, ensure Lillian knows the importance of insulin, practice hand hygiene and the 7 rights of medication, seek doctor's advice if dosage or medication seem unnecessary, and monitor the vital signs and common side effects, also encouraging medication compliance. Those involved in administering insulin and medication include the nursing team, the pharmacist, treating physician, endocrinologist, and the GP post-discharge. Intervention 4 is wound inspection and care. We chose this to ensure an optimal environment for Lillian's wound to heal and to prevent deterioration of her health due to the development of pressure injuries. We will do this by providing adequate nutrition for wound healing, controlling Lillian's BGLs as the sugar harbours bacterial growth, regularly assessing surgical incisions for heat, redness, size, etc., using appropriate dressings, regularly completing a pressure sore risk assessment, discouraging sedentary behaviour, and regularly checking for pressure sores. The nurses would be involved in assessing and taking care of the wounds and escalating care if necessary. Intervention 5 is encouraging physical exercise and diet management. This will help Lillian manage her symptoms, reach a healthy body weight, and support her to prevent her from deteriorating and ensuring a better quality of life. We can initiate referrals and encourage regular visits to the dietitian and physio or exercise physiologist. We can support regular eating of small amounts of food whilst on the ward, ensure a low-fat, low-GI diet, spread carbohydrate intake throughout the day, encourage regular movement around the ward, and monitor fluids and weigh regularly. Many people are involved in this, including the nursing team, dietitian, physio, exercise physiologist, treating physician, and endocrinologist. We have also included some other nursing interventions and ways to manage Lillian's symptoms. To help with Lillian's blurry vision, we can determine the degree of vision loss, assist with administration of eye drops or medication, organise an eye exam and make referrals. We need to monitor and record Lillian's blood pressure, administer and encourage compliance of antihypertensives, and monitor her fluid intake and urine output. There are several things we can do to combat Lillian's fatigue, including encouraging sleep hygiene and teaching relaxation and meditation techniques. To help manage Lillian's PCOS, she needs regular checkups with her gynecologists, and we can support her with her lifestyle management and medication compliance. Discharge planning for Lillian includes liaising with her treating team and making sure she has supports once she has left the hospital.
The National Safety and Quality Health Service Standards (NSQHS) guidelines were created in 2012 to ensure access to consistent, quality and equitable healthcare. In addition to common nursing practice, 3 NSQHS standards are pertinent to Lillian's presentation. Consistent with maintaining skin integrity, Standard 3, preventing and controlling health-associated infections, is crucial when cleaning, suturing or changing her post-operative wound. Ensuring that appropriate protocols and procedures are in place and followed in regards to hygiene and infection control can prevent almost half of health-acquired infections in Australia. It is also vital that Lillian's medications are prescribed, dispensed and administered appropriately in accordance with Standard 4, and she is made aware of the implications, risks and side effects of any medications prescribed to her, particularly in relation to insulin and its safe injection. The prevention and management of pressure injuries for Lillian, Standard 8, is relevant as type 2 diabetes is a high risk factor for pressure injuries because of its association with neuropathy and poor circulation. Her weight and immobility further exacerbate the need for pressure injury preventative techniques.